Show of hands from everyone out there who has not had COVID. Not many hands anymore. Fortunately, this latest surge is more of an annoyance than a danger, though we do know that long COVID is going to be a lingering issue for some who get it. Others out there are wondering how soon they can catch it again. At the rate that the latest variant's been spreading, our Nusha Roy was curious too, so she started gathering some answers.
If you're in the throes of it, at the beginning or end of your latest COVID journey, we started wondering, when can you be infected again? In general, infectious disease specialists say you're unlikely to be infected again within 3 months. But there are reports after having Omicron, some people were infected as soon as 2 to 4 weeks later. They also said vaccinated individuals had higher protection against reinfection, but for both situations, the numbers are small.
What we're seeing with Omicron in general is more mild infection than we saw with previous variants. And then with subsequent infections or infection after vaccination, we see less severe disease.
If you're like so many of us relying on at-home tests, how accurate are they at catching variants versus the original strain?
The exact same tests that we started out a year and a half ago, 2 years ago, when we were just getting these home tests, but they are effective at picking up these new variants, more specifically the Omicron variant.
The tests use a highly conserved part of the virus genetic sequence for detection, so the mutations haven't impacted this. But remember, at-home tests are less sensitive than PCR tests. So how do you approach isolation when everyone in your home is falling sick at different times?
If another person gets sick in the household, their countdown starts the day they have symptoms.
It doesn't extend the first person's isolation, in part because they have some natural immunity.
So specifically for isolation, this countdown is from when you first start having symptoms or you're testing positive. Right now, the guidance is you could stop isolating after 5 full days if you don't have those symptoms anymore. You wear a mask for another 5 days. The state health department says it's not required. You can test again at that point, but if you are still positive, they're suggesting it might be a good idea to still isolate for that full 10-day period. And I have personally been reading up on this a lot. Some of those questions were my own because I am out of the the depths of COVID over the last 2 weeks is why I kind of disappeared for a little bit. But had to revisit so many of the things that we were talking about because I thought I had dodged it for 2.5 years and then it popped up in our house.
And and I think for the people out there who have been fortunate enough, like myself, to have avoided it so far,
right.
Even if we're not really worried about feeling crummy for a couple of weeks, long COVID though is still a concern.
Yeah, and you know what? There's so much research to be done. Doctors aren't entirely sure exactly who is susceptible yet, right? Because they've seen it in severe cases, they've seen it in mild cases. They're saying the vaccines are helping, but we know it's a thing. So Colorado actually has a new state law that is setting aside money to take a look at our hospitals and our clinics to say, are we equipped to handle long COVID and the health issues that are coming with it, because they know this is going to manifest in some people over time. And so there's a lot of information with the state health department to kind of navigate what to look for. And one of the many questions my family's been wondering ourselves.
Yeah, so they don't get caught flat-footed.
Exactly.
Right. Anusha, thank you.